Welcome, everyone, to the Long-Term Services and Supports Financing Initiative webinar. We're going to wait just a few seconds here for people to join us before we get started. So thank you. Okay, well, thank you everyone for joining us. It's a pleasure to be here with you today for our Long-Term Services and Supports Financing Initiative webinar, where we talk about our initiative and provide an overview with time for discussion as well. Please note that we have our Q&A enabled, so as the presentation is going through and you have questions to elevate, please be sure to raise them in the Q&A. And then you can also speak at the end and ask your question by voice as well when we have our discussion. Next slide, please. So just an overview of today's speakers. We're going to start out by hearing from Susan DeMorris, Director of the Department of Aging. I am Sarah Steenhausen, Deputy Director of the Division of Policy, Research, and Equity for the California Department of Aging, and I will do a portion of the presentation. And then we're really fortunate to be joined by Dr. Mark Cohen, who is co-director of the Leading Age LTSS Center at UMass Boston and also professor of gerontology at UMass Boston, while also serving as director of research for Community Catalyst. So we're so fortunate to have Mark helping lead this initiative, and he's going to be talking about kind of the detail in the work underway for LTSS financing and affordability initiative. Next slide, please. It's my honor to welcome Director Susan DeMorris to make a few opening remarks. Welcome, Susan.
Thank you, Sarah, and good morning, everyone joining us today. We are so excited to finally be talking with all of you and those who will listen later to the recording about California's LTSS financing initiative. I'm thrilled that you get today to meet the amazing team that we've assembled, led by Dr. Mark Cohen and the rest of the consulting team that you'll hear from, as well as Sarah Steenhausen, who's been leading this work since the Budget Act passed, and we had the good fortune to receive funding to support this work and continue the Newsom administration's commitment to LTSS financing. So I'm so pleased to be here today. Like you, I'll be listening in, and I really just want to thank our consulting team, Sarah Steenhausen and her staff team at CDA, our partners at the Department of Healthcare Services and the Health and Human Services Agency, as well as DSS, DOR, who've been working on this behind the scenes. And today marks the debut of our public-facing efforts that will continue for the foreseeable future with all of you and others as we move forward and make continued progress. Back to Sarah, and thank you for joining.
Terrific. Thank you so much, Susan. Next slide, please. So for an overview of what we're going to be covering today, we're going to start with a background and context that really framed what the why of this initiative, and then further kind of explore what the profile of aging is in California, as well as the current state of long-term services and supports financing. And at that point, we're going to hear from Dr. Mark Cohen, who is going to cover the challenges that are faced by middle-income older adults in paying for long-term services and supports. And then he will provide, importantly, the overview of the Department of Aging's long-term services and supports financing initiative and the various bodies of work associated with it. And then finally, and importantly, we're going to have a time for discussion, and we really encourage all of you to elevate your questions, your comments, your input as we embark on this initiative. Next slide, please. So before we get started, we thought it was important to ensure that everybody has the same working understanding of what we mean when we talk about long-term services and supports. So long-term services and supports are the non-medical functional support that people need in terms of assisting with activities of daily living, such as bathing, dressing, eating, walking, but also with the instrumental activities of daily living, such as shopping or meal preparation or financial management, money management. LTSS can be received in either the home or the community setting, as well as institutional settings, such as a nursing home. And long-term services and supports are provided both by paid direct care workers, such as home health aides or personal care aides or certified nursing assistants, among others, as well as unpaid caregivers, such as family or friend caregivers that provide the bulk of services to people in the home and the community as they age. Next slide, please. So a background and context for how this initiative fits within California's Master Plan for Aging. Next slide, please. With the Master Plan for Aging, we're really trying to focus our efforts on the broad 4 system components that impact our ability to proceed with long-term systems and support system transformation. The first is navigation. Navigation is really getting at how people access the information they need to make informed choices. We understand that it's often very challenging and to find the information that people need to make informed decisions. And this is where a lot of our work falls to develop a no wrong door system to better streamline access to information and supports. But even if we succeed in developing a more streamlined approach to information, we know that we also have to address the issue of access. So we need to ensure that the services and supports that people need to age in the community are available on a statewide basis. And this is where our efforts to embark upon a home and community-based services gap analysis and roadmap are underway. This is a two-part effort, or a two-part analysis, both focused on Medi-Cal, which is led by the Department of Healthcare Services, and non-Medi-Cal services and supports, which is led by the Department of Aging in partnership with other Cal HHS departments and partners. The third issue is workforce. So how can we ensure that even if we've built out our infrastructure and we've made it more easy for people to navigate the services that they need, how can we ensure that we actually have the trained workforce, both paid and unpaid, to provide the critical services in the home and in the community that people need as they age? So this is where a lot of the efforts fall in the Master Plan for Aging, to build the workforce pipeline and to develop training and incentives for the direct care workforce. And finally, and very importantly, is financing. Sorry, can you go? Thank you. How we can ensure that the system has the financing it's needed to support navigation, access, and the workforce needs. And that is, of course, the focus of our discussion today. Next slide, please. So on this issue of addressing long-term services and supports affordability, really understanding what the problem is. You know, when we talk about the definition of long-term services and supports, the non-medical functional support that people need in the home, in the community, or in institutional settings. The problem is that there is no main financing mechanism for this. So as people age or as they acquire a disability, Medicare, the federal health insurance program, does not pay for long-term services and supports. So many older adults, people with disabilities, and caregivers struggle to finance their long-term services and supports needs. So that's where this initiative comes into play. The focus is to research best practices. We need to define what the target population is and identify the policy opportunities that the state can explore to address this issue. Next slide. So the statutory authority that was given for this initiative, we were really fortunate that the governor and the legislature invested $5 million of general fund dollars into the Budget Act of 2022 for an initiative to conduct research and analysis and develop options for improving long-term services, supports, financing, and affordability in line with the Master Plan for Aging. And this is what we are here to talk about with you all today. Next slide, please. So just to give a context for all of this effort, we wanted to just draw your attention to the profile of aging in California. Next slide, please. I know it comes as no surprise to most of you that our population is aging. And what's really unbelievable is when you look at the population growth that from starting in 1980 and what's projected through 2060, we see upwards of, in some areas of the state, over 400% increase over that time period. And I think what really sticks out to me with this figure is that when you think about our home and community-based service delivery system, it really was built starting around the 1980s and formed around then. So I don't think at that time there was the anticipation of this tremendous growth in the population and what that could mean for service delivery. Next slide, please. When we think about the growth of the aging population, what's also really important is to think about what is the total percent of the population by county of older adults. So really striking in some areas of the state, such as Sierra County, Plumas, Mariposa, Modoc counties, you have upwards of nearly 50% of those population that is comprised of people age 60 and over. So again, pointing to the importance of ensuring that services are available in these all regions as people age. Next slide. What's also really important to underscore is that California is blessed to have a very diverse population. So not only is the California's population aging, it's becoming more diverse. So you can see here that in relation to the rest of the country, this is even more significant in our state. And what this really underscores is that we have to ensure that services and supports are culturally responsive and appropriate so that all people can access them, inclusive of all languages and cultural traditions. Next slide, please. We also need to look at poverty among older Californians. And what this chart here shows you from the American Community Survey is that as people age, we see starting at 60 years and then for the 75 years and older, increasing rates of poverty. It's really important for us to consider how we can ensure that those who fall in the middle income ranges can be protected from falling into poverty. We want to make sure that those who are lower income can get access to the services and supports that they need. And we also want to ensure that people don't have to impoverish themselves to pay for the services and supports that they need. Next slide, please. Just a broad overview of our current state of long-term services and supports financing. Next slide. When you look at the federal level, and this is a slide that was put together by the Kaiser Family Foundation, and again, this represents our national expenditures on healthcare. The U.S. spent over $400 billion on long-term services and supports in 2020, and that's nearly 10% of all national healthcare expenditures. And you can see that across institutional and home and community-based settings, Medicaid accounts for a significant portion of these expenditures. And again, this is our public expenditures for long-term services and supports. Next slide, please. When you look at the projected payer groups for long-term services and supports between 2021 and 2025, almost half of all LTSS, 43%, is covered by Medicaid. And importantly, 37%, again, almost half or a third, a little over a third, is covered by out-of-pocket expenditures. This is really critical to look at because we ideally want to decrease the amount of out-of-pocket expenditures that people are responsible for as they pay for their LTSS financing needs. And what's also important in this pie chart is to see that private insurance, private long-term care insurance, only accounts for approximately 5% of long-term care expenditures. That shows that that market has struggled to really address the long-term services and supports financing needs. So we need to find alternative approaches. The state and the federal government are bearing much of the burden in terms of Medicaid expenditures. And then, of course, the individual and their families are also struggling because of the high out-of-pocket payment. Next slide, please. And now I'm so pleased to turn to my wonderful colleague, Dr. Mark Cohen, who is helping really lead the body of work for this initiative. He's going to start by providing an overview of the challenges faced by middle-income older adults, and then he's really going to dive into what the body of work we have underway is under this initiative to address this issue. Thank you, and welcome, Mark.
Thank you, Sarah, and thank you, Susan, and other colleagues in the department for the opportunity to really work on this exciting project. Even before I get started, it should be clear to everybody who's been involved in this issue area that LTSS and LTSS financing in particular is a team sport. And so while I may be presenting today, I'm standing in line with some really terrific partners that are leading various elements of this initiative, and I'll make reference to those as I go through the presentation today. So could I have the next slide? So there are, and Sarah mentioned this, there are a series of challenges facing middle-income elders as they age and confront the prospect of really needing significant amounts of long-term services and supports, LTSS. In particular, given generally modest incomes and facing no real financial and care delivery protection from either the private insurance market or from the public Medi-Cal program, their retirement standard of living in the presence of LTSS need is severely threatened. Now, many of this growing group of financially vulnerable older adults will need home-based care to support their daily living needs, and there's really no dedicated, readily available income stream to cover these services. So the implication is that they may face an uncapped liability for these services. And Sarah referred to this in another way as saying they may need to spend all of their income and savings down until they reach Medi-Cal eligibility. And frankly, Medicare does not help much, since individuals and families only have access to Medicare's post-acute benefit for a fairly time-limited, rehab-oriented basis to support a skilled need. So a lot of times when that medical need ceases, so too do some of the supportive services that they still may need, especially if the need has been brought about by some functional impairments or even severe cognitive impairment. It's also the case that middle-income individuals and families have no visible or easily identifiable care management or care advocacy points of contact that could help them access both individual and family needs as they traverse the system, identify appropriate service solutions to help meet those needs, and even help them think through how to best use their limited financial resources to match need with appropriate services. So in short, this group, which is often overlooked in public policy discussions, has real needs as they age. Chief among them, the need for some level of financial protection from potentially devastating LTSS costs. Could I have the next slide, please? The group also faces some system-level challenges. I'll be brief here, but for example, it may be very challenging to find a central registry or point of contact to find trained and qualified care providers that can be accessed. It may be unclear, what standards for provider training are adequate, what geographic challenges exist, especially in areas where there may be few Medi-Cal beneficiaries and a less developed service infrastructure, what type of marketplace oversight in home-based care delivery is available, and whether the level of oversight of provider quality for people providing services is going to be adequate. All of these sort of system-level challenges can result in increased risk for waste, fraud, and even older person mistreatment. Also, unlike individuals who are either privately insured or part of the Medi-Cal system, there's no obvious grievance or appeals address or process for individuals if there are significant issues related to access or quality. As well, the decreased availability of infrastructure dollars to coordinate and integrate services across a broad continuum of care to meet varied individualized needs. And here we're talking about, acute, post-acute, and rehab, home-based care, palliative, and hospice. So if you don't really have organization or public agency responsibility to help this group, they actually may end up seeking care from Medicare-funded institutional services, accessing the emergency department more than they otherwise would, the hospital, the post-acute care system, which can not only contribute to suboptimal care outcomes, but also increased expenditures for high-cost healthcare services that might have been avoided. In short, they face a situation of you're on your own to navigate and pay for this incredibly complex service system. Good luck. Next slide. Now, before going into more detail about what the California LTSS financing initiative is all about, I did want to make one more point about Medicare, which is a program that typically we don't talk too much about when we discuss long-term services and supports. And the primary reason is that it really doesn't cover much of the LTSS need. And Sarah pointed that out earlier. So can I have the next slide, and you'll understand why I'm raising this issue. As you can see, and the information in this is based on work that ATI Advisory did for the state, looking at historical Medicare spending trends among different subpopulations. And it turns out that those with functional needs are really major drivers of acute care health spending. In fact, those with functional needs disproportionately consume Medicare dollars. 20% of the population ends up consuming roughly 50% of the dollars. And this population also accounts for two of every $3 spent on some of the highest cost services. So the implication is that there's at least a possibility that if we could better support such needs, we may also be able to bring down some of these high acute care costs. And I raise this point because in thinking about potential new ways or models for increasing support to help middle-income older adults meet LTSS needs, one of the criteria put forward in statute for the CMS Innovation Center is that an approach needs to show that it can address a defined population for which there are deficits of care, leading to either poor clinical outcomes or potentially avoidable expenditures. And some of ATI's early analysis of this population suggests that there's an opportunity for, and they could benefit from, better, more cost-effective care. And they may be experiencing real deficits in care. So, the other point I'll make is that these statistics don't actually adequately capture the extremely challenging moments for these individuals who experience them. Here we're talking about, trips to the emergency department, accessing long-term recovery in a rehab facility, or even significant services at home. And so by aiming to improve care for these individuals, there's a potential for cost savings, of course, but more importantly, CDA and DHCS have a real opportunity to mitigate the harm of leaving this population's needs unmet potentially as a result of inadequate financial support. Next slide. So here I'm going to start to get into the overview of the initiative itself. Next slide. While as you'll see as I go through this, there are many individuals and organizations working on this initiatives. They can be classified into three major categories. First, and leading, is the California state leadership. And here I'm talking about Sarah and other colleagues at the California Department on Aging in very close collaboration with the Department of Healthcare Services, as well as the Department of Rehabilitation, Department of Social Services, and the Health and Human Services Agency. The lead contractors on this project include UMass Boston, which I'm a part of, Community Catalyst, which many of you know is a very large healthcare advocacy organization. And we have a great deal of support from Wolf Eagle Enterprises, which is led by Gretchen Alkema. Finally, there are multiple subject matter experts representing a set of high-quality partners. And I'm going to point out how each of those partners are working on various aspects of this initiative. The next slide. So this is an overview slide for our main areas of focus. There are really four main areas of our work, and I'll go into a little bit more detail after giving this high-level overview. So first, there's research and data. And here, what we want to do is outline the current and projected needs of California's older adults and people with disabilities who fall into this overlooked middle category. That is, we want to provide policymakers with the latest information and empirical data focused on the current and projected future needs of this population, okay? And in particular, our focus is on those people who are not currently eligible for Medi-Cal and are very unlikely to access the program in the future. So we're taking a longitudinal projection-based view on this. Second of all, and when we do that, of course, we're going to be identifying some of their unique needs, their risks of needing long-term services and supports, their availability of family caregiving support, and so on. The second major piece is policy and research. And here, what we're talking about is conducting policy analysis and providing options to consider for addressing some of the needs of this population. Just for expectation setting, there are, across all of these policy issues, there's no single program or approach that's likely to address all of their needs. We want to make a significant dent. The third piece of our work is to explore a Medicare HCBS demonstration proposal. And here I'm talking about considering approaches for a Medicare home and community-based care benefit. And finally, we want to consumer and stakeholder input. We want to deepen our understanding of the population's needs. That is, not just from the quantitative modeling perspective, but to actually engage with individuals in this population and stakeholders, both to validate and understand better, deepen our understanding of the needs they face, okay, as well as subpopulations within that broad grouping, and also to begin to socialize and get input on the attractiveness of various policy options that may be available for addressing those needs. Now I'll dig in a little bit deeper. Could I have the next slide? Okay, so this first area, engaging state leadership. So clearly, given the importance of this initiative and the potential implications of its findings, we are really committed to broad-based engagement. And this includes such things as connecting with master plan related stakeholder groups and state leaders to get input and perspective, providing a series of ongoing webinars. And this is a prime example of one, just doing some level setting about what this initiative is all about. And we will have more of these as results become available. Conducting a wide swath of consumer focus groups and listening sessions with communities representing diversity of California's population of older adults, people with disabilities, and caregivers. And we plan to do some polling and survey data of California's middle income or overlooked income population. And you can see here the list of partners that we're working with to assure that our stakeholder and consumer engagement is comprehensive and well conceived. And this includes collaborative consulting, Community Catalyst, and NORC, which is at the University of Chicago. They will be working with us on our polling work. Next slide. Defining and analyzing the target population profile and needs. So leveraging some of the existing efforts, we're going to be conducting some significant California-focused data analyses to project and characterize the older adult population not currently expected nor expected to be eligible for Medi-Cal. We want to understand the size of this population, understand their future LTSS needs, identify some of the factors driving that potential need. I should mention, by the way, that necessarily by doing this exercise, we will also be projecting, although it's not the prime focus of our analysis, we'll be projecting Medi-Cal usage in the future as well. We also are going to be mapping how the population is currently arrayed across California's 58 counties and try and connect some of that data to the current service infrastructure mapping that's going on. Sarah mentioned the HCBS gap analysis. And here we're thinking about, how can we get more granular in understanding where there may be particularly large gaps between services and the unique needs of this population. As part of this, we are also going to be analyzing and valuing the housing stock of this population with an eye toward better understanding the extent to which this typically non-liquid asset could be leveraged to help pay for needs, understand for some people what is required to be able to age in their communities. And you can see our forecasting and analysis partners. The Urban Institute will be doing a lot of our quantitative modeling. Jen Malinsky from the Harvard Joint Center for Housing Studies will be focused on a lot of the housing related issues and also providing input into some of the modeling. And our team at UMass Boston will be also using some data sets to validate and also add additional information on the population forecasting. Next slide. So under the leadership of CDA, DHCS, and CalHHS, we're exploring how we might collaborate with the Center for Medicare and Medicaid Innovation, CMMI, to develop a pilot project that would help meet the home and community-based service needs of this population in a way that meets the objectives of improving services and generating the necessary savings for acute care costs in Medicare. So to that end, we're conducting actuarial analyses. We're fully designing, we're designing and pricing the proposal, a proposal for CMS. We hope to respond to clarifications and questions and provide the necessary analytic support to really explore this in detail with CMMI. And our partners on this are ATI Advisory and Milliman, who will be providing the actuarial support. Next slide. All of this is really designed to lead to a set of policy options. And we're going to be doing that not only by learning from the analytics that we do about people's needs and so on, and from the consumer engagement efforts, but we're going to be doing an inventory to try and identify and locate innovative programs, financing programs across the states, and also digging down into localities that may be involved in investing in innovative programs that are focused on this middle income, this overlooked middle income group. So we'll be reviewing literature, interviewing key leaders that are running some of these programs, capture some case studies, and generate a knowledge base to inform potential approaches. And the idea is to consider how what's going on in other places around the country might be relevant to California, to the California policy environment. and examine their acceptability or favorability by obtaining input from stakeholders engaged in the project. And here we have, basically the most of the team that will be involved in putting together this set of policy options to consider. Recommendations may or may not flow directly from that, but it's the focus here is really on policy options. And finally, my last slide. Our goal is to take these very connected but somewhat disparate bodies of work, okay, compile the research, the analysis, the consumer and stakeholder input, state leadership input into a framework for evaluating the various policy options. And what we want to do is develop a summarized choice list of relevant, high-impact policy and program solutions for the state leadership to review and consider. And everyone on the primary team will be involved in helping to shape and craft that report. So, Sarah, I'm going to turn it back over to you, and we can then move to the next section.
Great. Thank you so much, Mark. We really appreciate it. And I just want to let you know, in terms of next steps, there's clearly a lot of different bodies of work that are moving forward. So we anticipate having, ongoing stakeholder webinars, potentially every quarter or as needed, to update everyone on the progress of this initiative. So really appreciate that wonderful overview, Mark. And I think now what we would really like, most importantly, is to hear from all of you. So please feel free to raise your hand. I think it's always best to hear from you as much as possible. Or if you would prefer to type your question in chat, you can do so as well. So I will open it up to Q&A. We did have a question and comment from Renee Cohens, who is with Caregiver Resource Center Network, and she just elevated the critical importance that caregiver supports and respite and other related services are in terms of addressing LTS needs for people in the community. And she wanted to really get a sense of how this is being considered as part of this initiative. And I pointed out that this is clearly a consideration for us as we're looking at the range of services that people need in the home and the community, particularly as we explore the potential concept for a Medicare home and community-based services, but also thinking about our gap analysis and roadmap, and really the important role that caregiver services play in our home and community-based services gap analysis, as well as our caregiver equity roadmap that will be released soon. So
and maybe I'll just add one point to that, Sarah.
Yes, please do.
Because you're absolutely right. And one of the reasons we want to do this sort of landscape analysis and look and see what's going on in other states is that while everyone recognizes the importance of those services, there may be models of delivering them that differ from what what would normally consider. And that's, sort of the creativity of this is seeing, and, you can discover really interesting models of care and delivery at very localized levels. I mean, that's why we're not just stopping at the state level. We want to dig a little deeper and see whether there are programs out there that are really successful. And that is one service I think you correctly point out is really important. And we may learn about how it can be delivered in ways we haven't thought about.
Great. And I also thank you for that. That's a very good point. It's state and local combined approaches. Also wanted to answer a question that somebody elevated in the chat, in the questions, which is what's the timeline of this initiative? So the final report that Mark highlighted will be submitted by the end of June of 2026. So we have a good 2 years now to embark on this work, and we really see it as it's not going to all just be completely sequential. There'll be a number of moving parts that are happening at the same time, and we hope to be, elevating a lot of our learnings throughout. So Appreciate that. Okay, we have, okay, great question. Somebody asked if we could please explain how this long-term services and supports financing initiative will build on the California Department of Insurance long-term care insurance task force report, as well as the Department of Healthcare Services actuary report that was developed in 2019 with Milliman on the exploring of a LTSS social model benefit. So I can answer that question. For those of you who are not familiar with this initiative, there's been several bodies of work underway over the past several years on this issue of long-term services and supports financing, starting with the Department of Healthcare Services in 2019, worked with Milliman actuaries to take some data and look at what it might cost the state and what's the actuarial case for a state benefit for LTSS, so a public benefit option. So that further informed the body of work. Taking it a next step, then there was legislation that established a long-term care insurance task force to also look at this issue. And that was led by the California Department of Insurance. And so there was an appointed task force that worked for over a year, I think almost 2 years, on what it would take, what are some options for establishing a public benefit through potentially using, a payroll tax to establish a long-term care benefit. And so that effort is separate from this. Of course, that is something that stakeholders, the legislature can pursue, and I know that there's a lot of interest in that, but this effort does not focus on the issue of a public benefit because so much work has already gone forward in that space. So Mark or others, I know we're joined also by Anastasia from Department of Healthcare Services, if anybody else wants to weigh in on that.
I'll just, the only point I'll make is that to some degree, regardless of what happens ultimately with one initiative or another, these can be also thought of as somewhat complementary. The work that we're doing, one of the things that you find in, for example, other countries that have implemented programs, social insurance programs, is that, I said this earlier, very rarely do they address all needs. There are still many remaining needs, and there are lots of opportunities. I guess my own inclination is you let 1,000 flowers bloom. There are many opportunities to address, because this is a very complex set of needs. A lot of opportunities for addressing needs. And so I think this work is, focused on a very specific population and set of needs that is relevant and will remain relevant in all contexts.
Yeah, absolutely. So I see that we have a hand raised, which is very exciting. We get to hear live from Kevin Prindeville. Kevin.
Go ahead, Kevin.
Hi, Sarah. Thanks so much. And Mark, great presentation, and thanks for the work so far and the work to come. This is Kevin Prindeville with Justice and Aging. So really excited by a lot of what you talked about, and also know that there's stakeholders, Justice and Aging partners that are also doing analysis, thinking about policy options, talking to others, asking questions that you all might be able to answer. What's the best way for stakeholders to engage if we have ideas we want you to consider, or we have questions that you might be running data on or doing research around that would help inform stakeholders' efforts that are all pointed in the same direction? What's the best way to make sure we're getting ideas in front of you and that we're learning from what you're learning as stakeholders broadly are also trying to solve the problems that Sarah so well laid out at the start today?
Mark, do you want to take that?
I mean, I think that I would say, especially on the solution set, I mean, we're going to have a team that's going to be doing a lot of the serving, and we certainly do not want to, we don't want to recreate the wheel. We want to find the wheel, the pieces of the wheel and put it together, and we'll do some recreation. But if, Kevin, in particular, if there are ideas or that people are thinking about in particular in regards to this population, I mean, we want to hear about it. As I said, our idea, I think at the end of the day, we're talking about a menu of choices, and we want to test some of these with consumer groups and so on. So I would say you should feel free to feed them, and to Sarah, to me, and we'd be happy to engage on that. We haven't, like, there's not a formal structure for that, which is why I'm actually glad. We're going to have a lot of different stakeholder meetings, but if there are, you shouldn't have to wait to send ideas. So you should feel free to do that. That's really what I'm trying to say.
Right. Kevin, does that answer your question, or do you want to add anything else to that?
No, that's great. Very helpful. Thanks.
Wonderful. Good, thank you. So we have a few other questions in the Q&A. One I want to speak to is a question from Meredith Chalimi with Leading Age. Meredith notes that there are many, models to consider, including the housing-based model called California Integrated Care at Home, which is a model that seeks to bring services and care coordination to people in their home environment. And so she wanted to know whether this study will consider these sorts of housing-based option models. Mark, this is somewhat similar to the SASH model that we've learned about in Vermont and other states as well. And Meredith, feel free to raise your hand if you want to add on to that. But Mark, do you want to take a stab at that question?
I think part of what we're going to be doing is looking at some of the housing. I mentioned that the Harvard Joint Center for Housing Studies, led by Jen Malinsky, is going to be looking at housing stock and specific issues that may encumber or facilitate aging in community. And we have not honestly honed in yet and completely defined exactly what aspects. I've been involved in housing and services work here in Massachusetts with Hebrew Senior Life, and so I'm very familiar with that and the SASH model. It may be there may be ways to make those more affordable for folks, but I will say that we are focused more on the financing side than on the service delivery side. So I know going into this, we're not going to be able to address all of those issues, and our focus is on programs that can help people pay for some of these services. So it's an important program. I don't know how much, in fact, we'll be able to touch on that in this initiative.
All right, thank you so much, Mark. And then another question that came through is, are there any public documents available at this time on a potential proposal for the Center for Medicare and Medicaid Innovation and interest in the detail? And I can just say that at this time, this is really in the exploratory phase. There is no official proposal at this point. So I appreciate that question very much. As we work with our partners in this project to try and define the business case for this type of a potential pilot project, and we work closely, under the leadership of the Department of Healthcare Services, once we have something more concrete, we are going to be thinking through how we can, engage our partners publicly and develop, any kind of written materials for your review. So Mark, feel free to add on to that.
No, we have really fantastic experts led by Tyler Comer and the ATI team that have had experience working through these sorts of projects. And so there's a flow, I believe there will be a flow between the state of California and CMMI. And so I think it's really unclear at what point, certain things can become public, because I think there's a lot to be learned about how to actually get something to be appealing, successful, and work.
Thank you so much. This is a really interesting question from one of our attendees. Would we be considering contracting area agencies on aging at state, county levels that are providing funding to support LTSS that are currently being offered through the county and their partners for them to continue to provide services to the consumers and even expand them? So thank you for this question. I think that as Mark noted, our focus right now is really on the financing side. But of course, when we look at different models to explore, we really want to be always thinking of how we can leverage the strength of our aging network and our area agencies on aging, and our work separately but related to in the 2030 initiative is really thinking about how we can support and expand the role of that the area agencies on aging play across the continuum, and making the important connections across health and long-term services and supports as part of the broader service delivery system. So more to come on that. And I think the answer to that is absolutely yes. And it's evolving in many places outside of and in addition to this initiative. Susan, feel free to jump in if you want to make any other comments for that as well. So, okay, good. Thank you for your question. And then there's a question about whether we will be coordinating with ACL grantees that are working on financial security for caregivers. So the answer to that, it's a little hard. I don't know in particular which ACL grantees the question is being, the questioner is asking about. So I think in general, that kind of makes me think about the implementation phase of this initiative. Again, this is we're doing a lot of research and development right now. So we don't have a program that's been launched. But in the event that the result of this whole initiative comes to programming and any new delivery models, we absolutely would want to coordinate with the network and with the range of federal and state partners that are involved in this area. And feel free to raise your hand if I have not fully answered the question. Okay. Oh, I think those are all the questions that we have gotten thus far. Any others that here we go. Let's see. There's one. Here's a few more. Here's a question from Tatiana Facio. Welcome, Tatiana. Families and individuals must start early in developing a LTSS plan and not wait until one actually needs long-term services and supports. The HICAP program, which is the Health Insurance Counseling and Advocacy Program, often gets a call from a family member at the time that LTSS is needed. Tatiana says she has spent many hours helping family members piece together the resources they need based on the ability to pay. What will the HICAP modernization project address LTSS planning and needed funding? So first, Tatiana, thank you for this important question and issue you raise. It is true that in an ideal situation, everyone would have these conversations much earlier, and that it's not, so often I think, and I could say, speaking from personal experience, we've seen this happen in my own family's situation where you don't have these conversations and then you're all of a sudden facing the emergency where people need services and support. So it's a great point that ideally we would get a conversation in the community and about the importance of planning sooner and earlier. This initiative doesn't squarely focus on that, but certainly we recognize the importance of it. And then you asked the question about the HICAP Modernization Initiative, which is a separate initiative that CDA is leading to really try and leverage the strength of the HICAP program to ensure that we're reaching more of the Medicare beneficiaries in our state. So I would say to that question, it's a wonderful question, I think, to elevate as part of the modernization efforts. I think that in our stakeholder engagement through that, we can certainly consider, many opportunities for high cap. And if there's other thoughts to that right now, I'm happy to, if anybody else wants to add to that answer, but I think it's certainly would encourage you to elevate that as part of that process. Okay, and then a really great important question about, can we discuss how equity will be addressed when we're looking at the landscape? So I want to turn to Mark, but I do also want to just elevate this, because I think when we talked at the beginning about framing this conversation, and we look at the aging of our population and how, a few of the slides that were presented showed not only is there a tremendous growth in the aging population as a percentage of the overall population, but the population is becoming more diverse. And so this just underscores the incredible importance of ensuring that services and supports are culturally responsive. I would say that few things from my perspective, I think that this is something that we certainly will want to consider in terms of the policy options and the financing mechanisms of what are the policies that we can pursue that ensure that we build in the culturally responsive services and supports and really look at where population needs are. And in addition to that, our home and community-based services gap analysis and roadmap. Really, I think the goal will be to look across the state and understand where the populations are residing and what, where the demographics call attention to the need for, ensuring culturally responsive services and supports, so that we can build out services that are culturally responsive through the home and community-based services roadmap. So I don't know that, I think we're going to have the issue of equity front and center in this initiative and in all initiatives. But Mark, in terms of the research that you're undertaking, can you speak a bit about how that will be incorporated?
Sure. Thanks, Sarah. So first of all, one of the reasons that we are working with Rich Johnson over and the Urban Institute is they have a dynamic simulation model that is based on some very comprehensive, detailed information, and in particular for California, that will enable us to really model out subpopulation groups by age, gender, race, ethnicity. So we will be able to both, have a good current snapshot as well as a projection going forward about their needs, level of family support, projected incomes, housing, and so on. That's really foundational, I think. And we often take it for granted. I think we all want to jump immediately to solutions. I'm the same way. And always I try to remind myself, I need to step back and say, well, wait a second, like what is unfolding in front of me right now? What is the base case? What are things going to look like without anything happening? And so the plan is to break out subgroups and focus on subgroups. That's on the quantitative side. On the qualitative side, we are going to make sure that the listening sessions and the focus groups have overrepresentation in some cases of individuals from typically underserved communities, so that we make sure that we hear their voices as it relates to specific issues and challenges. And when we start talking about potential solution sets, make sure that we get their input and reaction to that. So it is, I didn't mention it, or I didn't highlight it in the presentation, but it's always been sort of front and center in all of our conversations. Sarah, you're still on mute.
Thank you so much, Mark. A few just more logistical questions, and very important, is there a landing page on the CDA website for this initiative? We are going to be developing a web page for this. So at this point, there's not, but we will be sure to follow up as soon as we do have that website established. And then the following question is, what is the name of this initiative? Great question. It's not really an exciting name, actually. I think we need to think of a new name. It's the Long-Term Services and Supports Financing Initiative. That's kind of boring. And we've always kind of struggled with what to call it, but that's really what it is. And then underneath it, there's many other initiatives that fall, that Mark outlined as part of the body of work. So it's a multi-part initiative. And then we hear from Eileen Coombs. Thank you, Eileen, for your question. She said, thanks for this webinar, important work. Does this initiative and the data consider and include the impact on family caregivers as well? Great question. Mark.
We are, one of the things that Urban is going to be doing is looking at the need of individuals and their available supports, both current and projected. So the answer is yes, and it may very well be the case that some of the most dynamic programs for this population could end up being family support programs. That given the way that they use services, the specific needs that they have. So it is definitely part of the constellation.
Terrific. Karen Lustig, she says, this is more of a comment about the workforce issue and leveraging the housing stock. There would be a huge benefit of getting CPAs, lawyers, and even real estate agents who are trained to work with older adults in this area. If these professionals could somehow be extra vetted so seniors can know who they can trust with this very important transition. Thank you for that comment. Mark, what are your thoughts on that?
Who could argue? Who could argue with that? I mean, that is very true. Early on in the presentation, I talked about the fact that people don't actually have sort of a trusted source and repository of vetted information and so on. And that, that's one of the challenges that they face. Again, I don't want to overpromise, so that's a very important educational issue. It's a very important infrastructure issue. To the extent that we discover that there are programs that are really helpful for people on the affordability front, and it involves some of that and training some of those people, we will elevate those.
Thank you so much, Mark. Okay, there are no open questions. I will leave it. We will just pause for a moment to see if there are anybody else wants to either elevate a question or a comment at this time. And in the meantime, I just want to thank our team here at CDA, Carol De Andreas, our wonderful stakeholder engagement manager, as well as Brian Carter and Jackie Tompkins, who's our director of the project director for the master plan for aging, as well as our other project partners here. But hold on, Patty DeCamp says she has a new name if we want. So please, anybody that has a name for this initiative that they would like to suggest, we are all ears. You can always send it to us by email at engage@aging.ca.gov. Patty suggests the new face of long-term services and supports. Thank you. That's a very creative idea, and we will absolutely be accepting all suggestions for it. But in the meantime, you'll know that we'll phrase this as the LTSS financing initiative, and we appreciate everybody's engagement on this very much. And I, of course, want to extend sincere thanks to Dr. Mark Cohen for your tremendous leadership on this. It's just been invaluable having you and Wolf Eagle Enterprises kind of charting out the course with all of our wonderful partners on this initiative, including ATI, Collaborative Consulting, of course, Community Catalyst, and many others. So we're really looking forward to continuing this engagement. Thank you so much to Susan DeMorris, our director, for leading us all in this work and for your opening remarks. And I believe that's it. We are going to close for the day. We will keep in touch and keep you apprised of further opportunities for engagement on this. Thank you. Yes, we will make slides available too, as well.